Hi everybody, my name is Dr. Tanya Judge and I am a plastic surgeon in San Francisco, California. Today we are discussing labiaplasty and hopefully this will be a mini consultation for you before you go in and talk to a plastic surgeon regarding your own concerns. A labiaplasty is a beautiful, simple, and straightforward procedure to help proportionalize a particular part of your female genitalia called the labia minora. The labia minora are a thin piece of tissue that exists in between the labia majora, the puffs on the outside, and the vagina on the inside. For many women, this piece of tissue sits behind the labia majora. But for most and a lot of women, they're having issues with the existence of the tissue outside of the boundaries of the labia majora, and that can create a number of issues. Patients can have discomfort in certain types of clothing. It can also be noticeable in those types of clothing, as well as discomfort with certain activities like riding a bicycle, a motorcycle, or horseback riding, or even discomfort during sexual intercourse. And there are a lot of women that feel uncomfortable being intimate with a partner, and they're feeling self-conscious with the appearance of the labia minora during sexual intercourse. All of these are good reasons to discuss if a labiaplasty is a correct procedure for you. The way a labiaplasty works is exactly how you would imagine. If you have excess tissue of the area, we simply need to trim off the excess tissue and repair the defect in a beautiful way. And we've really optimized this procedure so that you have a sort of a really wonderful experience. So we have really optimized this procedure in a number of ways. We have created a technique that has a very limited downtime, a fairly fast recovery with beautiful results so that things are hidden and look proportionalized as if they were meant there the entire time. It helps you to then regain your confidence as a woman and to feel comfortable in clothing that you maybe not be able to wear before or activities that you weren't being able to be involved in before. A labiaplasty procedure can feel a little nerve-wracking and it is a very vulnerable area to speak about. So let's talk about how it works woman to woman. The procedure itself, like I said, is fairly straightforward. It takes about 2 hours total from start to finish. The first half of it requires oral sedation to get you really comfortable, as well as numbing cream on the outside to help get the entire area numb. So by the time the tiny little injection comes to the area, you don't feel a single thing. And many patients will attest to this. Then the procedure is performed in the way that you would anticipate, removing the excess tissue, the way we would have talked about before in your consultation. After the tissue is removed and things have been closed up, you go home the same day with a loved one or family friend, and you put ice packs in your underwear, and you're gonna stay with your feet elevated, laying on a couch for about 4 to 5 days. That means that you can catch up on some books, watch some movies that you wanted to watch, or work remotely, but you're gonna take off some time from work. After about 4 to 5 days, you come back in for your follow-up appointment to check to make sure things are going okay. I see my patients at week 1, 3, 6, 3 months, 6 months, and a year, and anytime in between that you feel that you'd like to come in. Your recovery allows you to then begin certain activities at certain times. At week 4, you're allowed to engage in strenuous activities again. That means working out, bar class, yoga class, spin, Pilates, your choice. And at week 6, you're allowed to engage in sexual intercourse. These benchmarks are to go aligned with your normal physiologic healing to make sure that you are reaching your appropriate milestones. At the same time, you're coming into the office to be seen and make sure that you're really hitting those milestones. You're not out there all on your own. We're walking you through the entire process. A lot of women will then be asking afterwards is there pain? No, there is not pain during the procedure, before and after. When you do start to have discomfort is about 4 to 5 hours after the procedure, and you're given pain medication to help that discomfort that you feel. Most patients take the pain medication for the first 2 days and thereafter downgrade themselves to Tylenol or nothing after that. The results that you can expect will be determined between you and your plastic surgeon, really trying to ascertain what you've had in mind for yourself to help achieve realistic goals. Definitely make an appointment if some of these are your concerns, and let me know if you have any other questions. Take care.